This is Dr. Ravindran Kumeran. I am a surgical gastroenterologist practicing in Apollo Firstmet Hospital's Kilpauk. Today I am going to address the topic of gallbladder stones, which is a very common problem in the community. Now, briefly, what is gallbladder stone? Anybody who forms a stone in their gallbladder is said to have a gallbladder stone problem. Normally, gallbladder is not supposed to form stones, and really there are no concrete theories as to why people form stones. It is at random. So for a particular patient, the exact cause of them forming stones is still unknown. This is very unlike kidney stones. Kidney stones is an entirely different spectrum. It is like comparing diamonds with rubies. They are completely different set of problems. Kidney stones are caused for specific reasons often, and you can find out why a particular patient has formed stones. In gallbladder, often it is not the case. Gallbladder is a very small partial storage organ which is normally present very close to the liver. Liver is the main organ which produces bile, and gallbladder stores part of the bile, usually in the volume of about 5 to 10 ml only. Now when this forms stones, sometimes they can cause problems. Not everybody with gallbladder stone has symptoms, but when you get symptoms, it's often very clear and very obvious as to what the problem is. Now this problem is much more common in women compared to men, and much more common in the West compared to the East. And within India also there is a huge spectrum. People from the northeast of India seem to have much more issues with gallbladder stones compared to people in the south. Now, when a patient gets symptoms, they are referred to as symptomatic gallbladder stone patients. And when they do not have symptoms, they are either referred to as asymptomatic patients, or you sometimes refer to that as incidental gallstones. You go for a checkup, you have a scan, and incidentally they say you've got stones. Now, people who have these so-called incidental stones really can afford to wait and watch. You don't have to immediately rush and have your gallbladder removed, especially if you do not have any symptoms associated with it. It is worth getting a consultation to confirm that you've not had symptoms because of it. And if your doctor confirms that that is not the cause of any of the problems, then it is often okay to have the stones for a while. Now there are some exceptions to this though. People who are elderly, people who are over the age of 60 or 65, people who have comorbidities. Now what I mean by that is other diseases associated with gallstones. For example, diabetes. Now diabetes is a particular disease where often infective symptoms are not manifested clearly. Now that is the reason people present to the hospital very late with diabetic infections and often have to have very aggressive procedures such as removal of toes or foot or leg even sometimes. So they do not perceive the sense of infection. This holds true for gallbladder as well. People who are diabetic patients often can have a significant problem in their gallbladder and not be aware of it. So those are the exceptions. Elderly people, because elderly people requiring emergency surgery would often be on drugs for thinning their blood, would be a diabetic or a hypertensive patient, may be out of control. It may not be, they may not be in their best health at that particular point of time. So elderly patients, it is always nicer to have a planned elective procedure whereby you go to a particular surgeon in a particular hospital and have the surgery at a particular date and time of your convenience. And diabetic patients, I would recommend the same. So that is for incidental stones. Now people who have symptoms, what are the symptoms which people can get because of gallbladder? There are mainly 4 symptoms: severe pain, jaundice, stones which have gone into the bile that cause jaundice typically. Just because a stone is there in the gallbladder, it does not give rise to jaundice, but when the stone slips into a tube which connects the liver and the intestine called as bile duct, people can have jaundice. The same stone in the bile duct can trigger what we call as pancreatitis, where there is inflammation of the pancreas, and patients can sometimes have infections. So we call that as acute cholecystitis. Now any of this, usually the patient perceives the problem. They would go seeking medical help, asking the doctor as to what has triggered the particular symptom. And you often do diagnosis such as relevant investigations to help the diagnosis such as ultrasound scan, sometimes even an MRI scan and a liver function test. And when you narrow down as to what the cause of your problems are, which in this particular case is the gallstone, then often there has to be treatment which is appropriate to it. If you have stones in the bile duct, then those stones have to be cleared first. Now, that often is done with the procedure called as ERCP, whereby a long specialized endoscope is used to fish out the stones from the bile duct. And they come back for their gallbladder surgery. Gallbladder surgery has to be done in spite of removing the stones from the bile duct, because further stones from the gallbladder can slip into the bile duct and cause the same problem again. So usually in the same admission, the patient has the ERCP, they usually give a day or so in between, and we go ahead with the gallbladder surgery. Gallbladder surgery these days are almost certainly done with laparoscopy. What I mean by laparoscopy is minimal invasive surgery, where you use small holes to achieve the procedure. Usually it is a straightforward procedure. Normal hospitalization would be in the order of about 48 hours for most patients, and recovery would be more or less complete in a week to, in a period of week to 10 days time, patients completely recover and become normal again. So surgery itself is not a huge huge undertaking for these patients, unless the patient is sick because of other reasons. If you have a very sick patient, then even this surgery can become a very major operation at times. But if the patient is a fit patient, if you have exceptionally fit patients, they can even have this surgery as a daycare procedure. You can come to the hospital on the day of surgery, have the procedure and go home. So people who have symptoms almost always have to have their gallbladder removed. Removal of the gallbladder, as I said, is a straightforward procedure. People can have a virtually normal lifestyle, including eating habits after the surgery. There is no kind of dietary restriction just because somebody's gallbladder is removed. And we are only talking about removing gallbladder for patients who have formed stones, which in the first case itself is a pathology. And if you have a normal gallbladder, you do not form stones. So removing gallbladder because you've got stones does not give rise to any additional symptoms or compromise the digestive mechanism at all. So if you have symptoms and if you have gallstones, please go ahead and remove it, because symptoms may not be simple every time. Sometimes you can have very complicated symptoms. So it is nicer to have these operations when you are nice and fit. I hope this was useful. Thank you.